Once your medical team gets a clear picture of the aneurysm, they will then help you decide the best course of treatment for your unique situation. Here's the doctor.
There are several potential courses of treatment for brain aneurysms, and the medical team will make recommendations based on the information gathered through patient tests and examinations. Sometimes the best course of action might be to not treat the aneurysm. For example, if the patient is elderly and there is significantly greater risk of stroke associated with the treatment, the risk may outweigh the reward. In other cases, the aneurysm may be so small that the treatment could be a riskier option than just leaving the aneurysm alone and monitoring it over time.
Some patients would rather choose this course of action, preferring to wait and see if the aneurysm progresses over time instead of choosing treatment. However, if the aneurysm ruptures, the actual amount of damage done is unpredictable. Others simply can't bear the thought of a potential rupture occurring at any time and feel compelled to have the aneurysm treated, even though the risk from the aneurysm is comparatively smaller. It is a very personal choice. You, your family, and your medical team need to work together to figure out what is best.
If treatment becomes necessary, a variety of options are available, each of which has its own set of risks and benefits. Here's Dr. Ogilvie to explain the first of these procedures.
Microsurgical clipping has proven effective over the years. Aneurysms occur on the blood vessels on the base of the brain. To get to the aneurysms, an incision is made on the side of the head. A small area of bone is removed, and an operating microscope is used to work underneath the brain to reach the aneurysm. A clip is placed on the aneurysm to eliminate the aneurysm and restore the affected blood vessel to its normal form and functioning capacity.
The second method is embolization. Here's Dr. Carter from the Mass General's Brain Aneurysm Center to explain this procedure.
Another procedure is called coil embolization. The coil method does not require cranial or skull incisions. The coil technique is done by a method called endovascular therapy. That means the procedure is performed inside the blood vessel, or endovascular. The endovascular coil technique uses the body's system of blood vessels to reach the aneurysm without having to perform open brain surgery. A specially trained physician inserts a very small tube, called a catheter, into a major artery that is safely accessed through the femoral artery, located in the inner thigh. The tiny catheter is directed through the artery to the base of the aneurysm. A very soft platinum strip, or coil, is fed through the catheter and inside the aneurysm. Often a number of coils will be needed to completely seal off the aneurysm. Once the aneurysm is full, the coils are detached and the catheter is removed. The coil embolization technique is FDA approved and is regarded as an effective and safe method for treating aneurysms. It is, however, also quite new, and despite outstanding clinical results, there is still a lot to be learned about the long-term effects of this exciting treatment. For instance, the chance of getting rid of the entire aneurysm may be lower than with open brain surgery. The ultimate decision to clip or coil an aneurysm is usually made based on the specific risks and benefits of each procedure for a given patient.
Of course, treatment is just the first step in your recovery from this condition.